So good afternoon to all of you. Today we are going to study how to get the dimensions of a lacerated bone. So you are having knowledge about the type of lacerated bones. So some are the incise-looking lacerated bones that are on the bony prominences. So they appear to be incise-like, but they are actually lacerated bones. In this practical, we will be studying how to measure the dimensions of the lacerated bone. Since the major difference between the incised wound and the lacerated wound is the margins in case of incised wound are yes. In case of incised wound they are clean cut, while in case of lacerated wounds they are irregular. And when there is contusion inside it, then we call it as a continuous lacerated wound. So it is very necessary that we should know the dimensions, we should know the direction, we should know the number of lacerated wounds present over there. Okay. So in this mannequin we are having two lacerated wounds present over the face. This is a common finding whenever you are there in a casualty or whenever you are posted in an emergency department. Frequently the cases of road traffic accident they come there, and you can see that these are the lacerated wounds present over the face of the patient. So first of all, we have to stabilize the patient. Stabilization is the priority than the medical legal formality. Frequently this patient will come with aspiration. Some type of aspiration will be there in the gastric oral mucosa. So we have to aspirate those contents. There will be secretions in the oral mucosa, then we have to aspirate them. Then whenever we have stabilized the patient, the bleeding is stopped, then we can start examination of the bone. So we should have a measuring tape or a measuring scale. So the wound can be measured or the injury can be measured with the help of a measuring tape also and a measuring scale also. So by proper positioning of the patient is very important. So ideally I should not stand behind the patient. It is the suitable position we have to take as per the direction of the patient, from where we can measure the wound very efficiently. Such as this one is on the left side of the patient. So we can start, for the easy visualization, I can easily see this wound on the left side, and I am very comfortable on this. To start, we will measure the length of the wound. So length of the wound is about, how much is the length of the wound? So it is about 3 centimeters. Since it is a lacerated wound, it will be having a second component, that is the width. So this will be the width. Whatever gapping you are seeing in the wound will be the width of the wound. So the wound width is about here 0.2 centimeter. So it is 0.2 centimeter. And the third dimension will be the depth of the wound. So how is the depth? We should not probe the wound. Else it will have a secondary bleeding also from the wound side. Secondly, it will inflict pain on the patient. So we have to avoid the probing the wound. We can easily see the dimensions of the wound. It is roughly about 0.1 centimeter. So the depth of the wound is about 0.1 centimeter. So the length, width and depth 3 centimeter by 0.3 by 0.1. So this completes the first part. The second part will be the direction. So you can see the wound is obliquely placed or vertically placed or horizontally placed. How it is the position? It is obliquely placed. Third part will be the present. Where it is present? It is present on the yes, in between nose and the lips. We have to calculate one of the distance from the one of the landmark. That is, here is the left ala of the nose. From here, the wound is about 2 centimeter. We can easily measure it. It is about 2 centimeter from the left ala of the nose. And third point is about the whether it is freshly bleeding or not. Whether it is fresh or not. So here you can easily see the edges. They are torn and they are having bleeding points. So this is fresh wound. Okay. So similarly, we can examine the wound on the right side also. That is, it is extending from the right ala of the nose up to the upper lips with one of the segment which is a separate segment. It has to be measured in 2 parts, 1 and 2, with the other segment extending up to the right angle of mouth. Just above the right angle of mouth it is ending. So accordingly